Okay. Welcome to Medic Monday here with the Dyer Armory. I am not David Scalf. He is getting his grill worked on, so the next time you see him, hopefully he'll have some diamond encrusted gold plated teeth going on there. So in all seriousness, my name is Brian. I have known David for a pretty good little while. We have worked in the same department. I've been in fire EMS for 12 years. I have worked in a very violent area for pretty much the duration of that time. So I've run more gunshots, homicides, murders, assaults, cardiac arrests, any of that stuff than I can even begin to remember. So, you know, David, he's out today, so he asked me to step in and cover a few things. So one of the things I want to talk about is some things that you don't hear on medical gear training and just medical training in general. So it seems like medical training, and you hear this a lot from guys that do med stuff, is it gets forgotten or neglected a lot. It's like that unwanted stepchild, so to speak, where it's like a necessary thing that we got to have, but it's not as cool as blasting down the range and obliterating something, which, you know, gunfights don't happen very often. People get hurt multiple times a day, every single day. So you have a higher possibility of doing good and making a difference in somebody's life by having a good, well-stocked med kit and just having something on you that you know how to use, you know how to apply, you know how to talk to people, you know how to assess a situation, right? These are skills that you can use as a parent, as a spouse, as a good neighbor, and just as a good citizen as you move and navigate around town. So I want to talk about some of those items. This kind of became pretty important to me as far as getting other people trained, navigating through the whole COVID pandemic fiasco, right? So the area that I work in, our department gets anywhere from 120 to 150,000 calls per year for some sort of service, right? So it's fire EMS based, all hazards mitigation based. We do a lot with law enforcement. We got a pretty active SWAT medic team. I'm not on that team. Currently I'm on leave, so you might be wondering, why does this fireman have this big, luscious beard, right? I've been off, so I go back in a couple of weeks. Anyway, so the thing through COVID that was absolutely remarkable to me was our wait times. We were sitting on scene, just fire, waiting for an ambulance, sitting on scene for 2 and 3 hours with a patient. Some of these patients would be just kind of a routine transport, not feeling good, want to go get checked out, all the way up to pretty severe cardiac patients and people that had been in car wrecks and were fully immobilized on a long backboard, right? I mean, there were guys waiting for a long time for an ambulance. And it was because there wasn't one available, because they were at the hospital waiting 3, 4, 5, 6, 7 hours for a hospital room. You can't afford to wait. In these kind of situations, as society continues to kind of take a tailspin down the tubes, as people continue to go kind of off the chart and off the rails crazy, you don't have time to wait for somebody to come and save you. You don't have time for somebody to come and save your loved one or your neighbor. You need to be able to act. You need to be able to use this equipment. Don't hear that very much, especially on the gun tube channels, right? Look at the major gun tubers just on YouTube, Instagram, whatever. They've got the little IFAK on the back of their belt, and that's about it. That's about all the care they're able to deal with, right? That IFAK on that belt is pretty much designed to handle one type of injury, and it's penetrating gunshot trauma. And that's about it. Your likelihood of encountering penetrating gunshot trauma is very, very small. But you could see somebody that's got a severe laceration, amputation, crushed in a car wreck, fell off a ladder, has a broken bone, has cut their hand or their arm in the kitchen, kids run through the house, fall through a glass door. I mean, I'm telling you things that I have run from personal experience. I see that more often than the multitude of shootings. So I want to talk about just kind of the equipment, right? So first thing I want to talk about is that IFAK on that battle belt. When you're putting together a kit for that, there's something that a lot of people won't say. Either they don't think about it or they don't have the courage to say it, but that kit is for you. That is not for you to use on somebody else. caveat there is if you need to use it on somebody, you should use it. But your primary mindset should be that that kit is there for you. And it's not necessarily for you to use on yourself. There might be a couple of items inside that kit that you can use to render self-aid with, but for the most part, it's for somebody else to use on you, right? So you are putting together a medical kit that is available for somebody to use on you should you get hurt. Should something happen to you if you're at a shooting range and you're having target practice or you're teaching your kids or whatever. When I was young, this is one of my most vivid memories of being at a shooting range. I think I was 8 years old. I was with my dad and my uncle. Just standing in a lane shooting a pistol by myself. I hear this slightly louder boom, and I see this metal flash to the top of my peripheral vision and through the bottom of my peripheral vision. I didn't think too much about it, so I kept shooting. Got done, put the pistol down, turned around to walk back to my uncle to let him know that I was done. And he and my dad are standing next to this guy who's got a towel wrapped around his hand, and he's just holding it, leaned over the table, and there's blood on a lot of things. And I look over at the table, my dad just kind of pointed at the table as they were talking, and there was a revolver, and the side of the drum, the round wheel, whatever it's called, was exploded. They told me later this guy had been loading his own rounds, overpowered his rounds, and exploded one, and it about blew his finger off. The metal went almost directly in front of my face, right? I went back to where I was standing in that shooting lane and looked up, and there was a hole almost directly over my head where the top of that piece of revolver had gone straight up over my face and straight over my foot. I don't think anybody had a Medkit. You know, this was 30 years ago, probably. Before any of this was popular or commonplace or almost kind of expected, right? So all that to say, if you have a kit and you're around somebody and somebody gets hurt, be free to use it, but think about, if something happens to me, what do I want to have available for somebody to use on me? There are only a few items in your IFAC that you're going to be able to render to yourself if you need them. Odds are you're not going to be able to apply chest seal to yourself. You won't be able to decompress your chest. You won't be able really to pack a wound in your neck or armpit or maybe even in your groin area. You're most likely not going to be able to do that. You're not going to be able to access your IFAC quick enough, especially if it's in the small of your back, to do those items. If you train on it, you may be able to do it, and training is exceptionally important. You may be able to give verbal commands for somebody if they come over. What can I do to help you? What can I do to help you? Get this kid off my back. Take out this item, put here, right? You might be able to do that, but really the only thing you're going to be able to do is apply a tourniquet. Out of all of the shootings and stabbings and intentional blunt force trauma that I have seen, people are not able to care for themselves. They're not able to render aid. It's always a bystander that comes over to render aid to them. If you're not training in a specific way to render self-aid, should you become catastrophically injured, you will not be able to do it in that moment. I don't care how cool you think that you are. It's not going to happen. If you're not practicing, if you're not going to classes and you're not getting training, you're not going to be able to help anybody. Your IFAC is for you, first and foremost. People don't say that. You don't hear that a lot, but I'm going to tell you, as a 12-year experienced paramedic in a very busy urban area, that kit is for me to use on you if I come to help you. The misnomer about EMS and fire departments is that we just have access to all this equipment just right at our disposal. There have been stretches of months and years where I have not been able to get a decompression needle to use on a patient, and I needed it. We had one kid one night, he was shot. Him and his buddy got shot outside of a barber shop at 10:30 at night, huge crowd of people. He had an entrance wound here and another one in his abdomen, and I want to say the exit wounds were below the waist. I think he had one more entrance wound. Anyway, That's the closest I've come to on scene needing to decompress somebody and not had the equipment. And by not have the equipment, like I hadn't had it in 6 months, and it took another year before I could get it. So just because fire and EMS are coming and they show up in even police departments, it doesn't mean they're going to have everything accessible to them. So if you can assemble some items together where somebody can use them to take care of you, that's really what you need to do. Yeah, that's pretty much what I want to say on that. Now, let me backtrack. Once you make your IFAC your care unit for you, be free to assemble some other items to take care of other people, especially your family members, because you don't want to neglect them. This gets said a pretty good little bit in the kind of the prepper community, I guess, but it should be said again, is if you are preparing medically to only take care of yourself, you're neglecting those that are most important to you, that you're actually trying to protect, that you're actually trying to stand up and take care of. So get some stuff together that you can use to take care of you. Also get some stuff together that you can use to take care of your family. I've seen a lot of kids with deep lacerations into their arms. We had one kid that he got mad playing a video game, punched through a plate glass door, and he cut down to the bone on both forearms very, very deeply. Family had a towel. We took care of him the best we could, got him to the ambulance, got him down to the hospital. When your family members are hurt, when your loved ones are hurt, you don't want to be the guy standing there saying, or gal, you don't want to be the one standing there saying, oh no, what do we do? You want to have the answers. Odds are if you're watching this video, you're the type of person that wants to have answers for uncomfortable, uncommon situations. And that's awesome. But just because you buy the stuff doesn't mean you're qualified. You need to get training. Go find training somewhere. You can get equipment from direarmory.com. They've got some pretty good IFACs put together. There's your plug, Dave. Go there, get some of their stuff. You can assemble some things together. I kind of have piecemealed a lot of my stuff together, but that's because I have experience. I have a lot of experience. If you don't have experience, don't try to piecemeal things together. Go get a kit that's together, put it somewhere, leave it. Go somewhere and get training and use somebody else's disposable equipment. You don't want to get stuff out and play with it. Keep it clean, keep it sterile as long as you can. So this is, I just want to show you guys real quick, this is my medical IFAC that I carry with me on a daily basis. Unless I am on duty on a fire engine, I have this with me. Otherwise, it's, you know, I go to work, I take it off, put it in my locker, I put it back on when I get off work. And there are some people maybe that I work with that are going to see this and be like, wow, Brian, you really are crazy. Yes, I am. You have no idea. But this covers the basics of penetrating trauma, massive hemorrhage. I have got some chest seals, wound packing material, MPA, Sharpie, Israeli bandage, SWAT-T tourniquet, some gloves, and some lubricant for the nasopharyngeal pharyngeal airway. But this, as you can see, my items are starting to get a little bit worn and haggard, and that's one thing you need to consider too, that you don't necessarily hear a lot of people say, is that this stuff has a short lifespan. So especially this NPA, which I'm cycling out, but this thing, my goodness, this is disgusting, and it's open, and I would not use this on a dog. I'm going to talk more about NPAs in just a minute. But you've got to take into account that your stuff is going to get worn down, especially if you're carrying it around. I've got another friend that carries some of this stuff in his pockets. You sit on it, you're going to be breaking up the package. A lot of this equipment, it needs to stay clean and it needs to stay sterile, because when you're dealing with penetrating trauma, massive hemorrhage, stuff like that, if you're putting dirty equipment on there, I mean, if that's all you got, that's all you got. They're going to get antibiotics in the hospital anyway. But you run the risk of increasing their chances of getting a septic infection, right? So that's when the infection goes from just being in the wound to all the way throughout their body. Now, if somebody gets a septic infection, that's very, very bad, because that can turn into a brain problem, right? A cardiac problem, a respiratory problem that is much harder to deal with. So if you can keep your equipment clean, keep it clean as best you can. If you are training with medical equipment on your battle belt, you're doing a lot of prone, rolling, running, rain, shine, whatever. You need to keep track. You need to keep tabs on your equipment on a regular basis to make sure that you still have equipment that is still holding its integrity, especially the packaging. So let's get into talking about some of the different things that you don't necessarily hear a lot of people talk about in videos. The first one are the gloves, the medical gloves that you wear. Those are primarily for you. They're not for the patient. So it sounds all good and noble to say, I'm going to put these gloves on because I don't want to put my dirty hands on this patient and give them something, right? That's like the damaged equipment in the messed up packaging. And that's true. But the reality is you're putting those on to protect yourself from any kind of diseases, viruses, or other conditions that that person has. You don't want to soak those in through your hands. Your skin is the largest organism that you have. It is designed to be unbroken. When it is an unbroken, or what's the word? I just went completely blank. When it's free of defects, it's not broken. It's an impermeable membrane, pretty much. But if you have dry hands, if you have scraped a knuckle, you have a blister, you have a callus that has freshly come off of your hand, something like that, you have a weakness, you have a hole in your membrane, right? That's the purpose of the skin, is to protect what's inside your body and help regulate your temperature. You put gloves on because should you have even just a tiny nick in a knuckle, you get that person's blood there, it takes all of about a microsecond for whatever is in their blood to go into your body and then begin to spread. Nobody wants that. So always, always, always have a pair of gloves, unless you are dealing with a family member that you know very well, whose medical history you know very, very well. You can get away with not wearing gloves, right? When I take care of my kids, when they get a cut or scrape their knee or break a bone, because I have 3 boys and I've had multiple broken bones, I don't put gloves on, right? That's just a little bit silly. Those are my kids. If it's my wife, I'm not going to necessarily worry about putting on gloves unless my hands are just really dirty and I can't get them clean. But if it's my neighbor or random Joe Schmo on the street, I don't want to touch them without gloves on. I don't. Especially stretchers. People, stretchers are disgusting. Just so you know, just a little rabbit trail here. Ambulance stretchers are gross. They're really dirty. You don't want to just walk up and be touching all of a stretcher, trying to lean in to kiss your loved one goodbye as they're in cardiac arrest, getting up on the ambulance. Go wash your hands. Don't touch your face. Don't touch your eyes. Especially, your eyes are the most permeable membrane in your body. So put your gloves on. They're to protect you. They're for you. They're not for the patient. They're to protect you. So if you can have a couple of extra pairs to help keep track of that, you know, because they tear, they break. If you put on 2 pairs, you're more likely to cause a rupture. So just put on 1 pair and keep an extra pair in your pocket. Side note, your hands will most likely get pretty sweaty, especially if you're doing a lot of work. If you go to put on some gloves and you can't get it on, don't try and tug. Just pull it back a little bit and blow into it. It'll inflate it. You just put your hand right in. Okay, good. So airway management now. So nasopharyngeal airway looks like this guy right here. This is the package. When it is new, it's all nice and white. This one is very haggard and worn out and disgusting, and this is probably going to go in the trash or become a training device. The majority of medkits come in one size, and it is the 28 French, okay? These come in a wide variety of sizes. The purpose of this is to go inside your right nostril, to loop around past the back of your mouth, to where the airway up here connects with the airway in your throat down into your trachea. Here's the idea for this, and it works pretty well, is that if you have a lot of facial trauma, somebody gets shot in the mouth, which I've seen many times, or beat pretty hard in the mouth, you can have a lot of loose teeth, blood, saliva, all that stuff inside the mouth, and it can cause a real problem for the airway. People will want to try to breathe through their mouth, especially if their nose is a little messed up. You don't want to put one of these in, but you want to try to help get somebody some air as much as possible. I have seen the way some people talk about gunshot trauma that I have personally seen, either in person or random YouTube videos, is somebody shot, get the airway, get the chest seal, get the tourniquet, pack the wound, you got to do all the things. And that's just not true, right? There are indicators for everything that we do. If somebody's got a messed up mouth, that's a good indicator for one of these, right? I've seen a lot of patients that were shot all over the torso, in the arms, through the mouth, and they were messed up and they needed a nasal airway to keep them patent. But here's what people are not saying. These come in a lot of different sizes. There's like 10 different sizes or more. This is not a one size fits all. This only fits a certain percentage of people. If you put this into someone that is very petite, right? I'm about 5'10". If you were to put this in my 11-year-old's nose, number one, it would be incredibly uncomfortable because the diameter of this is so large. It would cause some problems, first of all. Second of all, it would extend too far, and it could go into the esophagus, and it can activate the gag reflex in the back of the throat. This can induce vomiting, which can lead to further airway compromise and airway issues, and you don't want to do that. This is just for a certain kind of demographic of population, so what I recommend people do is learn how to put people in the recovery position as much as possible. So what that is essentially is somebody laying on their left side, head up underneath, arm up underneath their head, kind of like a pillow. The right knee kicked forward, this arm kind of out. What that will do is that will allow someone to breathe through their nose and their mouth, but it will also allow all the contents of the mouth that can be causing airway compromise to just drain out. That's a much better option than using one of these. Another problem with these is if you're not looking for significant head trauma, you could accidentally insert this into somebody's brain. Here's how that happens. When you insert this into somebody's nose, it actually goes in the left side, not the right side, left side. You do it starting upside down, and you rotate it as it goes in. If somebody's in a car wreck, and they have hit their head, struck their head on something really, really hard, and they've got some bleeding in their mouth, a little bleeding from their nose, you need to pump the brakes on inserting an NPA. They could have something called a basilar skull fracture from that, and there are some certain things that you would need to look for. That would mean the thin layer of skull at the base of the head that is just behind the oro and nasopharynx in the back of the mouth, particularly in the nasopharynx up high, that can be cracked or broken. I've seen a real x-ray of this. It tripped me out, right? Somebody took one of these and that kind of a patient and inserted it, and it went all the way to the brainstem. That's a problem. So pump the brakes on these, okay? If you are at all able, just manipulate the airway for the individual. Car wrecks, that's a whole different set of circumstances on how you treat that. I don't recommend people pull people that are unconscious out of car wrecks and just start manipulating them. You can end up paralyzing somebody. Just hold on, provide moral support, let us get there. But be careful with one of these. Get somebody in the recovery position where they're laying on their left side as much as is possible before you jump to doing this, especially if you're like me and have carried this around for 2 years in your ankle kit and this wrapper is disgusting. Don't take something like this and put it into somebody's body. That's nasty. That's really nasty. Don't do that. This is no longer for people. This is for training. I'm going to let my kids play with it when I get home. So there's your airway manipulation. Everything else, for the most part, that I'm going to talk about has one very common thing that's going to happen. That's going to be a pain response with the patient, minus chest seals. So chest seals, if you don't know, come in a package similar to this. This is a set of compact, high-fin vent chest seals. North American Rescue. So the thing with chest seals, should there be someone out there that just isn't familiar, this is to prevent a hole in the chest from sucking in air. If that happens, that's a bad day. David Scalf can give you firsthand stories on what it's like to have something called a pneumothorax, which is what you treat a needle decompression with. Talk about that in a minute. These are great. They're awesome. I've run a lot of gunshots at work where we didn't have these because, I don't know, they expired or they just were not available. And I wish that I had them. The thing you're gonna possibly have a problem with when you're doing this is if somebody is shot bad enough to need one of these, right? They're going to be really diaphoretic. That means they're going to be very sweaty. They're going to be very wet. What you're trying to do with these, I don't know if I said this. Let me back up. What you're trying to do is you're trying to prevent air from entering into the chest wall, which would cause the lungs to collapse, which would then put pressure on the heart, inhibiting its ability to beat correctly and get blood throughout the body. If you can't get blood from your heart throughout your body, you're not getting it to your brain, you die. Kind of a big deal. So with these are really, really handy for any kind of chest trauma. And you can almost just, if you know something has gone through somebody's chest wall, if you know somebody has been shot, you can be pretty confident slapping one of these right over that hole and calling it good. Just make sure you look for an exit wound. I've run with a lot of law enforcement officers say, yeah, you shot once in the chest. We put a seal on it. Where's the exit wound? Exit wound? Yeah, did you look for an exit wound? Oh man, no. Go and look. Sure enough, there's one on the back. Put something over that to cover it up as well. Again, one of the problems with these is if somebody is really diaphoretic and sweaty, they may not stick very well. So you need to be thinking about how you can wipe that sweat off real quick, or blood if it's bleeding, and get that thing covered up. These are terrific. They're relatively inexpensive. You're going to spend $10, $15, $20 for two. Very easy to carry around. These are really, really good. That's pretty much the end of the non-painful stimuli. So that's another thing that people don't talk about when they talk about med equipment, dealing with penetrating trauma, especially gunshot wounds, stabbings, people shot with bow and arrow, that kind of stuff. Is the rest of the stuff I'm going to talk about causes pain, causes a lot of pain, causes so much pain, in fact, that providers will stop what they're doing and back off, because I have heard people just absolutely howl in agony. One of those things is going to be wound packing. All right, so this is compressed gauze, which works really good for wrapping a wound, packing over the top of a wound, putting inside of a wound. Wound packing is very, very painful. It does not feel good at all. Wow, you'd have think I would have cleaned this stuff out beforehand. Real life. But this is very, very painful, because what you're doing is you're taking some gauze and your finger and you're jabbing it into a hole in somebody's body. There are a massive amount of nerve endings in the skin, at the base of the skin, throughout all the layers of the skin, and you are going to be pushing on those, and it's very, very painful. And if someone has any sort of consciousness about them, they're going to squirm and pull and yell, and good chance they're going to cuss you out for causing them pain. So you need to warn people if you can. If you're a gun guy and you're carrying this stuff around in the off chance that you get shot, you need to know this is going to hurt you. And for a moment, maybe just as bad as getting shot, maybe worse, because it's painful. And that's something you need to tell people, right? So if you run up on the street, say, you're at Walmart, and some emotionally deranged and turbulent individual decides they want to shoot everybody up there, because that happens, and you come up on somebody that's got a gunshot wound, first of all, you need to say, hey, I'm here to help you. I'm going to do some stuff, and you need to find the wounds, and as you begin to treat them, if you need to pack or you need to apply a tourniquet, you need to tell them, hey, this is going to hurt, but it's going to save your life. I have a great story for that. I'll tell you when I get to tourniquets. But this we use If you're not using it to go on top, you're using it to go inside. If it is a long bone or the chest wall, we don't do it, but if it's like, it may be in the elbow, but like in the neck or right in the hip flexor area, right in your hips, you can pack. Even in the thigh, you can pack if possible. If you don't have a tourniquet, you can pack and wrap tightly, and that will help too. Tourniquet is better, but you can wrap, you can pack, wrap, and compress really, really tight, and that will help get pressure deep inside the leg to help that vessel begin to clot. Anyway, this hurts. Tell people, hey, I'm going to pack your wound. This is going to hurt. I'll be done soon. And then do it. And if they start to squirm and move, just say, hey, hold on, hold on, hold on. Just be still, be still, be still, be still. And that will help a whole lot. But make sure you tell them this is going to hurt. Even in the midst of it, I know this hurts, I'm sorry, I'm so sorry, but I got to get this bleeding stopped, right? You have to communicate with people when you're intervening, especially if there's any fire EMS people that are watching. You got to talk to patients like they're people. Talk to them like they're people. If they are in pain and agony, let them know that you understand what's going on. You understand that they are hurting and it's no good, right? So another one that has the potential to hurt if you wrap tight enough is an Israeli bandage, which is designed to have a tremendous amount of pressure over the wound. That can hurt too, but it's going to be less likely to hurt. And a lot of those have clotting agents in it. The thing about clotting agents is that they do burn, especially if you're packing a wound with like a quick clot. Even if it is the civilian access, the EMS and the military too, those have clotting agents impregnated into the material, and it's going to burn. It's going to burn the person when you are putting it in. It's going to be very, very uncomfortable and painful. So just make sure you tell them, let them know, hey, I know this hurts. I know this hurts. Communicate with them, but do what you got to do to save somebody's life. The next thing I want to talk about here are decompression needles. These are not for the average person. Okay? Just because you have these doesn't mean you have any business using them. I'm going to get on a little bit of a soapbox here, and I'm going to tell you, if you are not trained to use one of these, do not open it. Do not attempt to stab somebody with it, because that's essentially what you're doing. This is the most invasive thing on this table. This can get you sent to jail. This is a bad deal, and if you do it wrong, you potentially could kill somebody. There are only 2 places in the chest wall that you can insert this. The first one does not always work. This is why I have 2, and you don't hear that a lot, is if you have one, you need another one, because the first one doesn't always work, or over time the catheter can get squeezed by the muscular in the chest wall, right? So the muscles in between the ribs where you're putting it, they can flex so much that they can actually squeeze that catheter, that plastic straw. They can squeeze it shut to where it's not doing what it's supposed to do, and you need a second. So why should you even carry these? This goes back to what I said at the beginning, because you want to have this available for somebody with skill and knowledge and training to use on you. There very well may come a day where the entire hospital system in America is so strained and overrun that there is no one to come in to help you. I'm not telling anybody not to go get training on how to use these. I'm not going to give any training on here. This is not the place. It's not the right context. But I'm going to tell you right now, the state of things that we live in now is that these are not for the average person to use. If you decide you want to get these to put in your kit, don't open it. Don't open it to look at it so you can see what it looks like, because you want to have an idea of what this thing looks like that somebody might put inside of you. As soon as this is opened, it is either used or it goes in the trash. It is not a toy. There was a time on my fire engine where we finally got these. I had emailed for 8 months to get a set of decompression needles in an area where we ran quite a few gunshot wounds. We finally got them, and within a week, somebody at that station on a different shift had opened them and taken them out, popped the plastic cover off of it and looked at it and put it all back together, put it back in the bag. I was so upset because I had a tool that is a tremendous asset that I could no longer use. This is also why you want to have these on your person in case somebody else needs to use it on you. Or you are somewhere and somebody else gets hurt pretty bad and EMS shows up. If they don't have any and there's a medic there, you can say, hey man, I had these are out of my own kit. You can use these if you need to, and you could very well save somebody's life. When it is time to decompress somebody's chest, there's no substitute. And even with the new ones, which are different size and different gauge, which are not available to me to have at home right now, I bought these over the counter, so to speak, in a store not too far from here, less than a month ago. But the new ones, they're just bigger, which is better. When somebody needs these, they make all the difference in the world. But if they're done wrong, right, because you have to slide in between the ribs, there's still blood vessels in between those ribs. If you do it the wrong way in the right spot, you can still lacerate one of those blood vessels and you can cause a tremendous amount of damage. And again, these, though, really are only to get you to the hospital. So if you decompress somebody, you need to let a doctor know. It's just important. But with these, so that's what a lot of people don't tell you, is that if you have one, you need at least a second, because the first is likely to be ineffective or to get crushed by the muscles, and you'll need a second one to decompress again. I know people that have decompressed the same person 5 times because of that very thing. The muscles just spasmed so hard repeatedly that it kept clamping off that catheter, and they had to keep popping over and over and over again. And this was in a relatively short transport time. So if you want to have these to be available for someone to use on you, get a minimum of 2. Now with these, I will say, just kind of as a deterrent, and another reason why you should be very slow to think this is really cool, because I've talked to people that say, oh yeah, I'm going to get a decompression needle and I'll do that and blah, blah, blah. No. Is you have to have a stethoscope. In order to truly diagnose the need for decompression needles, you have to listen with the stethoscope to lung sounds, and you have to make some physical assessment findings to make this justifiable. So, another reason why you should not think about doing this is most people are not carrying this, and they don't know what to listen for, and they don't know what to look for. So, that is the decompression needles. Your Good Samaritan laws too, I don't think will cover this. They may cover me because I'm a licensed paramedic and I currently have medical direction oversight. So, I mean, if it's truly a very bad situation and everything is crazy and taxed, if I were to do this on someone outside of my jurisdiction, I might be able to finagle being covered, but I would be very slow to do it. It's just not worth the risk, right? This done wrong can be just as legally troublesome as a legal shoot, defending yourself or a loved one, okay? That's how big of a deal these are, because it's intentional penetrating trauma to another person's chest wall. It's essentially what it is. So you don't want to take this lightly. They're good to have handy, they're good to have around, they have an expiration date on them, and you need to make sure that they are still good before you use it. That's kind of a provider thing to verify. That's all I'm going to say. I'm going to get off my soapbox on those. And then the last thing I officially want to talk about are tourniquets. And maybe Sam Splint, probably not, because I've already gone on for a little while. So tourniquets, what people don't tell you on tourniquets is, number one, is there are a lot of different styles. Unless you're really kind of research and look, there's a lot of different styles. Not all tourniquets are created equal. They have different applications and times for them. And you better know how to use one. If you're going to carry it, you better know how to use it. So this is a Cat 7 North American Rescue. This is kind of the standard issue for police, fire departments, EMS. is this very tourniquet, okay? If you're going to carry a tourniquet, you need something else to go with it, and that's a Sharpie. Because this tab here, you need to write the time on the tourniquet from when you applied it. This is of paramount importance, especially if whoever you're taking care of, especially if it's yourself, if they are going to be delayed in getting to the hospital for any length of time, the doctors need a pretty good reference, right? You don't have to have the exact time. You don't even have to write it on the tourniquet, though this is a great place because this is going to be free of blood and sweat and all that stuff, right? You can write it on the person's arm, on their forehead, whatever. But you need to have some kind of a note as to when you applied this tourniquet. So always carry a Sharpie. So rule number one, things that people don't say a lot, is if you have a tourniquet, you need a Sharpie because you need to write either on the tourniquet or on the person the time of application. Second of all is you need a trainer. This is a trainer. It is blue. Blue tourniquets are for training. Blue medical equipment in general is for training. Any other color is for regular use. This is for training. It's to help you know, because with a trainer, you don't have to worry about how many times you use it. With this, I would not want to apply it pretty tight over and over and over again in a training scenario, because it can wear out the tension strap here, and it can also wear out the plastic buckles here. And you don't want this to fail in real life. Use these for your practice and wear them down, degrade the materials, wear out the Velcro, practicing deploying it, doing all those things. Do that with your trainer and just keep these staged and ready to go, okay? So get a trainer. That's number 3, is you need a trainer. You need a trainer. You need a real Cat 7 tourniquet or other TCCC certified tourniquet, and you need a trainer. You need to train on these. I can't tell you how many tourniquets I've seen applied by police officers that were inadequately tightened. And this goes back to that pain response from patients is, you start cranking this down, right? You get it snug around the limb, you start turning this, 1 turn, that's pretty tight. 2 turns, that's starting to hurt the person, and they will let you know. 3 turns is about when you'll start to see some blood beginning to stop. It might take 4, might take more, might take less. It just depends on anatomy structures and that sort of thing with the patient. But we had a fellow in the last year or so. He was shot in both arms and in both legs. He was shot in his chest, in his hip, and in his mouth. And he had multiple tourniquets on when we got there. Police was in the process of tightening one of them on his arm when we got there, and this was where he was bleeding the most, right? He had one on his leg, it was a little loose. I ended up tightening that up 1 more turn. The other ones missed the major blood vessels, but the one in his left arm was bleeding pretty good. So PD got there and said, hey, I haven't tightened that up all the way yet. I said, awesome, I got it, and I started to turn it. And this guy who was barely conscious sat up howling at me, pushing my hand away, saying, no, 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 no. And I had to put my hand on his shoulder and say, hey man, listen, this is gonna hurt, but it's either it hurts or you die. You take your pick, which one do you want, because I want you to live. And he just looked at me. I mean, this guy, he was all messed up. He just looked at me, he just laid down, tightened it up, and he just kind of winced a little bit. And just that little bit of communication changed the whole course of care for that individual. And we did a few other things, but because we talked to him, right, you got to talk to people, he was able to let us do what we needed to do. So with training tourniquets, you need to train on yourself, and you need to train your family members with them. I have trained 3 of my kids. My youngest is 3 years old. She might be able to get the hang of it now. But my boys, all 3 of my boys, I toss this to them every once in a while to say, okay, put it on. Come put it on my arm. Come put it on my leg. Put it on your own arm. Because they just are a lifesaver. These are now 20-ish years into widespread adoption and use. They got a lot of their effective documentation in I think it was in the War on Terror in Iraq after 2001, 2002, right in there, because this became the gold standard for bleeding control. Even 5 years ago, in fire and EMS, the protocols, the standards were direct pressure on the wound, elevate, and if that doesn't stop, consider a tourniquet. Our protocols now are straight to tourniquet. If it is excessive bleeding, if it is a lot of bleeding, tourniquet. Put a tourniquet on. Put a tourniquet on. One of the things that a lot of people have trouble overcoming there's a lot of misnomers about these is a tourniquet means automatic limb amputation. You're not going to have your arm anymore, and that's not true. There are well-documented cases of these being in place on people for, I think, up to 8 hours, and they retained the use of their limb. Okay, so you're not going to lose a limb with these. They are the best way to stop bleeding. You don't put them over a joint, right, a bendable place in the bones. You don't always have to go high and tight on it. That's what a lot of law enforcement officers get trained on, is just high and tight, high and tight, high and tight. But if you have like a hand amputation, you don't have to come all the way up here. Just 2 inches above is fine with your tourniquet, and then crank it down and put it right there. You don't have to come way, way far up. For amputations, you always get a tourniquet, by the way. And it's not uncommon to need 2, particularly in the thigh, because that's such a big, meaty area. It can be hard, especially with larger individuals, for one tourniquet to be effective. If you have just a normal width tourniquet, they make wider ones that are super effective. They're really good. I don't have any of those. But all you would do is you just pair up a second one just above the one that you put on first. So have 2. That's kind of the other thing that people don't necessarily always tell you about tourniquets is you need a Sharpie, you need a trainer, you need a for real one. Well, people will say that. They'll say that a lot. But you need a Sharpie, you need a trainer, and you really need to have 2. This is an orange one. This has a different application. My black ones and my tan one here are more for my do stuff and get up. If you know, you know. If you don't worry about it. But this one is more for other people, for use on my kids, family, neighbors, stuff like that, because I want it to be visible. I want other people to see this when they come up on scene. I don't want it to blend in at all. These other things have blending factors to them for a specific reason. And then you need to store them a certain way. So if you see on this black tourniquet here, and on this orange tourniquet here, the red end of the strap is right over the top, and that is so they can be deployed easily and quickly, okay? You don't, on these kind of tourniquets, you don't want to be doing this number on somebody or even yourself. You want to have it in such a way that this stays pretty much a circle, so you can loop it onto your arm or loop it onto your leg. You need to practice doing it one-handed with both hands, both arms and legs. Never, ever, ever, this should go without saying, my goodness, never put this on somebody's neck. So you want to stage these well so that when you need it, it is just kind of right there, right over the top. You don't have to look for it. And then keep this, the windlass, kind of inside the catch here with the time strap kind of back to one side, because again, you don't want to have all this stuff like packed in here real tight to where you have to finagle all of this stuff to get it out of the way so that you can apply it to yourself. You know, trying to do all this stuff with one hand and your teeth, your weaker non-dominant hand, right? You don't want to be fiddling with all that. So just put it in a position to where you will be successful immediately. And you will do well for yourself if you do that. I keep both of them that way. My training tourniquet, I did not put this back together correctly after the last time I used it with my kids, but that's okay because I like to make myself practice with different things, because honestly, I find tourniquets like this a lot, especially with police officers and lay people, and when I go ride different fire trucks or work with different companies, not everybody stores their tourniquets the same. So you can practice that way too. So these are the cat tourniquets. This is an imposter cap that I got several years ago. This is made by Recon Medical, and they have received a cease and desist letter from North American Rescue because they pretty much copied their design to a T, except they added this hole here in the strap, which I think is pretty cool because it makes it a lot easier to pull it tight, but it's really not that critical. The windlass is metal, and it has this little dinky pin in it that you can use to write your time here. I don't personally want to have to fool with that. I would rather use a Sharpie because it will write. But the issue with these, and the guy over at Prep Medic, also a YouTuber, he got some really good med videos. Really, really good medical videos. He kind of dived into these a lot, but the issue with independent testing on these is that the plastic failed at a much lower tension than like a cat tourniquet. So the quality is off. Chinese stuff, American stuff. This is the backup to 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 the backup for me, and it's not what I would use Frontline. And then another option to that is the soft T. This tourniquet is great, and this is a great option to have, especially as your second tourniquet, because it does not have any Velcro to it. It's got the similar kind of windlass style here. You're going to have to crank a little bit more, but it does have the same kind of capture area here, and then this triangle folds over the top to help keep this in place. Should these break, this is very strong, and it will hold it in place. But the thing about these that I really like is that they can detach quickly, and then you can wrap around like a leg or something and hook it back together, tighten it up, and you are good. It's very quick, it's very fast. This is also, I believe, a TCCC tourniquet. That is great if you're needing to apply a second tourniquet, especially if somebody has a broken leg or broken bone distal to where you are applying, right? Somebody's foot is blown off and you're applying up on the thigh. You don't want to move all of that around too much before you can get a tourniquet on, for comfort of the patient, but also because you don't want to inadvertently rupture any other blood vessels unnecessarily if you can avoid it. It's just, you want to do the least amount of harm as possible to people. So, and it's also got a place to write time down here. So these are some options for you for those. There's your tourniquet talk for the day. So, wow, I have rattled on for a long time, so that's where I'm going to cut the live stream for now. So, you know, if you're going to carry medical stuff, you need to get training on it. There's a lot of good places where you can get training, get some good equipment. DireArmory.com, they've got some pretty good kits already put together with a pretty good price point. I've looked through several of these bags here, looked through the online store, and it's pretty good stuff. So you are getting good quality equipment there. And then, you know, go try to take like a Stop the Bleed class. If you are just a regular person, go to stopthebleed.com and you can find a class. There are a lot of good classes, so go take those. They're excellent. You will learn a lot there. And then for the industry guys, go look up, if you're not subscribed and following on the old Instagram, Savage Paramedics, European Medics, the Resuscitationist, and the NAR Doctor, North American Rescue Doctor. Those are excellent bits of information that will keep you up to speed on a lot of different things. So we'll call that the old Medic Monday live stream. Thanks for bearing with me. I guess I had more to say than I thought that I did. And that's going to be it. So if you have any questions on any of the stuff that I have made mention to, I'll try to keep an eye out on the comments. I know David will as well. So drop your comments down below. Make sure you like, share, and subscribe. Let's get the Dire Armory word out, get more people in on this. I know David, I've talked to him quite a bit about medical stuff. He feels pretty similarly the same way that I do. Like, this stuff is important. This is important. Like, this stuff is cool. This stuff actually saves people's lives. This mostly will sit in your closet or underneath your bed. You're not going to use this stuff very much. I have that stuff, and I'm telling you, this stuff collects dust. This stuff I actually use. So that is it. We'll call that end of show, and I'm going to DC this whole operation. Thanks for coming by. Thanks for joining, and we will see you later. Peace. I've got a lovely bunch of coconuts, deedly dee.